Welcome to Maverick Physical Therapy in San Diego, California, everybody. It's great having you with us today. What we're going to do to get us jamming and get us rolling to start things off, kickstart us, we're going to go through one of my favorite little activities, which I like to call the lawnmower. It's a little bit of a hybrid between, it is a hybrid between a lunge, a reaching lunge, and a row. It's kind of a pivot lunge. A common theme that we're going to be kind of talking about frequently is relative motion, really just being able to disassociate the hips from the trunk and the rest of the body so that we can properly load. One thing that we always want to remember is that movement is a direct response to how well the body loads three-dimensionally in all planes of movement, meaning movement is simply a response, again, to how well the body loads and the feedback that it gathers from all of its systems. We're going to have a few different episodes of the lawnmower. Today we're going to keep it pretty basic, we're going to keep it pretty simple. We'll go through our common and uncommon lawnmowers with our pivot lunges. All you need is a dumbbell, kettlebell, squishy medicine ball. You can use it with body weight as a little bit of a warm-up as well. To get us going first, our common lawnmowers with the right arm. You're going to take the right arm and left leg, you're going to go to an anterior lunge, to a posterior lunge. You're going to get that right arm to pull and that left arm to rotate and push to the right. So what we have going is we have the pelvis rotating left, we have the shoulder girdle and the trunk rotating to the right, giving us some relative right rotation throughout the thoracic spine. That type 2 out of sync, meaning thoracic spine and thoracic spine is rotating side bending to the same side. So we have our little anterior lunge, we have our posterior lunge with our pivot lunge, but now we're adding our little posterior medial pivot lunge, kind of wind up that front hip a little bit more, give us a little bit more internal rotation of that front hip. We can also add a little posterior lateral lunge with that as well. Keep things pretty basic, we'll just go our standard forward to backwards to get things going. It's really important that you get a good pull with that right arm and a good rotation and press with the left. We're now going to head into our lateral series. So we're going to go lateral lunge, posterior medial lunge, pivot lunge. Right arm is pulling, left arm is rotating and pressing to the right. Sink the weight right on down into that left butt and that left hip. Rotate and pull. We can sequence this a little bit differently as well. We'll go posterior medial, but now we'll also go just straight posterior. Here to here. Kind of load a little bit more in that sagittal plane, the deceleration of hip flexion. Whereas before that posterior medial, we were obviously getting frontal plane, a side to side motion, a sagittal plane, forward and back. But the emphasis was with the rotation. We're also going to add a lateral lunge to an anterior medial, lateral lunge to an anterior medial. One of my favorites now as we sink into that lateral lunge, but now as we come up, we don't lunge, we just basically take a miniature version of that, a little step, with the right foot staying nice and pointed forward so we can load up that right butt and that right hip into internal rotation, which is really important when that back leg is being used in gait, for walking and running, for a lot of our throwing and propelling activities as well. The third and the final of our common lawnmower pivot lunges is our rotational. So we have our posterior lateral. We're going to sink and rotate into our anterior medial lunge. We have some in-sync rotation going now as we finish. So we have out of sync with the posterior lateral with that load. And now we have in sync with our finish, meaning we have pelvis rotating right, we have thoracic spine relative motion due to the shoulder girdles rotating right as well. So here, to here. And we can also, my favorite again, is to come with that posterior lateral and just add the step across with the rotation of that left foot to give us that good relative internal rotation at the right hip. We'll also add that posterior lateral lunge to the anterior lunge. Kind of mess that up a little bit, but so we get on some unstable surfaces and kind of playing around a little bit sometimes. What we're going to do next